Namaste everyone. Today we will see some important asanas for the diabetes type 2 patient. Let's start. First we need to understand about the term of diabetes type 2. Okay? So in the diabetes type 2, in the pancreas, beta cell does not work properly. That leads to glucose does not enter into the cell. That leads to sugar level increase your blood stream. Therefore, diabetes type 2 occurs. During the practice, if you feel any discomfort, then stop the practice during that time. Okay? Now we will move first asan, Mandukashan. So for the Mandukashan, first come into Dandasana. Out stretch your legs in front of the body and both palm behind your buttock. Slightly bend back and make sure your spine should be straight. Look forward. Now from here, first fold your right leg and then fold your left leg. Come into the Vajrasana. Both palms place on your thigh. Look forward. Inhale deeply. Exhale slowly and completely. Now make a fist. Make sure during the make a fist, thumb inside your fist and then make it. Okay? And fixed join each other and then fist place near your abdomen. Make sure fist touch your abdomen. Okay? Now start. Inhale deeply and exhale slowly. Now mentally prepare for Mandukashan. Inhale deeply and while exhaling, bend forward. Try to touch forehead on the floor. Stay for some time in this position. Breathing should be normal. During the practice, focus on your abdominal region. Totally focus on your abdominal region. Now, with inhalation, come up. And first, release your hands on me. Then unfold your right leg. Then unfold your left leg. And both palms beside your buttock. And relax for a while. Those people who are suffering from peptic ulcer, hernia, knee injury, ankle injury, and pregnant women and high BP patient should avoid this practice. Now we are going to next asan, Paschimottanasana. So for the Paschimottanasana, out stretch your legs. First, coming to Dandasana. Look forward. from here, both palms placed beside your buttock. Mentally prepare for Paschimottanasana. Both arms inhale, both arms up over your head. With inhalation, stretch your arms more and more. And while exhaling, bend forward and grab your big toe with your hands. And exhale completely and bend forward completely. Try to forehead touch on your knees and between your knees. And relax whole body and stay for some time in this position. Focus on your abdominal region during the practice. Okay. Now, with inhalation, come up. And slowly, hands down, arms beside your body. And relax for a while. Those people who are suffering from sciatica, slip disc, peptic ulcer, hernia, and recent surgery of your abdomen, and pregnant women and high blood pressure patients should avoid this practice. Now we will move next asan, Ardamatsend asana. So Ardamatsend asana, for the Matsend asana, first come into the Dandasana, and now from here prepare your mind for the Ardamatsend asana. Now fold your right leg first and then fold your left leg, left foot beside your right thigh. Okay, and now from here right arm up with inhalation, and while exhaling twist to your left side, slightly twist, exhalation with exhalation, and grab your left foot with your right hand and inhale, and while exhaling look behind and stay for some time in this position. Breathing pattern is normal, natural. Focus on your abdominal region. Now inhale and neck forward. And first you release your hands and then release your right leg, then release your left leg and relax for a while. Now we will do the same practice with another side. Okay, so first fold the left leg and then right leg. Then after that, raise your left hands beside your left leg, okay, and then grab your left foot and inhale, and while exhaling, move your neck, look behind, and hold for some time in this position. Breathing pattern is normal and natural. In this position, focus on your abdominal region. Now from here, release the posture. First, move your neck forward with inhalation. And while exhaling, stretch your left arms and down. And then after that, release your leg. Right leg first, then left leg, and then relax your body. Those people who are suffering from osteoporosis and neck injury, spinal injury, and peptic ulcer, hernia, and recent surgery of your abdomen, pregnant women, and high blood pressure patient should avoid this practice. Now we will move next asan, Bhujangasana. So for the Bhujangasana, first lie down on your mat on your abdomen. So let's start. Now relax your whole body. Close your eyes. Now prepare your mind for the Bhujangasana. So first join your legs and slightly open your eyes, and chin touch on the ground, both palm beside your chest. And inhale and torso body up into the navel region with inhalation, and hold for some time in this position, and look upward. In this position, aware on your abdominal region. Now from here, while exhaling, down, and relax for a while. Those people who are suffering from neck injury, spinal disorder, and severe lower back pain, and pregnant women, and recent abdominal surgery, hernia, peptic ulcer, and high blood pressure patient should avoid this practice. Now we will move last ashan, Ponukashan. Okay, for the Ponukashan, lie down on your mat in Savasana. Okay, now relax whole body in this position. Now from here, inhale deeply, exhale slowly and completely. Now mentally prepare for the Ponukashan. Okay, so for the Ponukashan, first join your legs, bend your knee and try to bring your knee, try to touch on your chest. Listen and grab the shin bone with your hand. First interlock your finger and grab your shin bone and try to touch knee on the chest. Okay, and inhale, and while exhaling bring your head up and touch chin between your knee. Okay, inhale and exhale, come up. Stay in this position for some time. In this position, focus on your abdominal region. Breathing pattern is normal. And now inhale and down your head first, and first raise your hands and then fold your leg and relax for some time. Inhale deeply and exhale slowly. Now turn your right side and then come up and relax for a while. Those people who are suffering from spinal injuries, neck injuries, and abdominal recent surgery, peptic ulcer, and hernia, and pregnant women, and also ankle injury and high blood pressure patient should avoid this practice. Thank you for watching. Jai Sri Krishna.